Healthcare costs represent the single largest fiscal challenge for the federal government, the single largest competitiveness challenge for American business, and a growing concern for American families. We must engage in comprehensive healthcare reform. The truth is, today, we spend more of our economy on healthcare than any other nation by far. We spend double per capita than any other industrialized nation, and yet we get below average results. For example, we have above average infant mortality, below average life expectancy, and way above average medical error rates. We're not getting good value for money, and yet we have 50 million Americans that lack any insurance. The status quo is unacceptable. The status quo is unsustainable. We must engage in comprehensive healthcare reform based on 4 key dimensions: coverage, cost, quality, and personal responsibility. On coverage, yes, every American should have basic and essential coverage that's affordable and sustainable over time and avoids taxpayer-funded heroic measures. Things like prevention and wellness and protection against a catastrophic accident or illness that could wipe one out financially. Yes, we must have a limit on how much the federal government will spend on health care. We are the only major industrialized nation that doesn't have one today. Every other country has recognized that health care costs could bankrupt their country if there wasn't some limit. We need one. Thirdly, we need to move to evidence-based practice standards to improve quality, to enhance consistency, to reduce cost, and to dramatically reduce litigation risk, because compliance with these standards would be a safe harbor for medical malpractice claims. And fourthly, we, every American, must assume more responsibility for our own health and wellness. You know, the sad but simple truth is most of the healthcare costs are driven because of our behaviors. We need to have better diet and nutrition, and we need to exercise more. America is not only number 1 in healthcare cost, we're number 1 in obesity. And that's not good, because that's a leading indicator of diabetes, it's a leading indicator of heart disease, it's a leading indicator of joint problems and other situations that means more cost and a poor quality of life for Americans. So yes, we have to engage in comprehensive healthcare reform. But in doing so, we must take a fiscal Hippocratic oath. Do no harm. The federal government has already promised way more than it can deliver in the area of healthcare. Comprehensive healthcare reform must improve our financial condition and our long-range outlook. We cannot, we must not make more unfunded promises, which is what happened in the case of Medicare prescription drugs. It dug our hole deeper, $8 trillion, despite the fact that some claimed that it would save money. We must adopt a show-me principle. You must be able to demonstrate that cost savings will in fact work. We can't go on blind faith. Hopefully, we'll achieve comprehensive healthcare reform in the not too distant future. But if there's an effort to try to expand coverage without paying for it, that should be rejected. We've been there before. We must not shoot ourselves again.